I'm Dr. Jyoti Mayadev, co-chair of the Cervical Cancer Subcommittee, and I'm really excited to tell you about our new study for locally advanced cervical cancer. It's labeled NRG-GY037, and it's open to enrollment. It's for patients with locally advanced cervical cancer, T3, T4 lesions, so that is patients who have tumors that are involving the pelvic sidewall, involving the lower third of the vagina, and patients who also have potential bladder or rectal involvement. All of these patients could have lymph node positive or not, and they're on the FDA-approved pembrolizumab label. In terms of the key eligibility, it's for, again, women with locally advanced cervical cancer in the curative setting. Patients are then going to be randomized to induction, chemotherapy, and immunotherapy. The chemotherapy will consist of carbotaxol weekly, like was as given in the Interlace study, and the synergistic effect of pembrolizumab. Patients are then treated with the standard of care, chemoradiation pembrolizumab, followed by maintenance pembrolizumab. The other arm is the standard of care arm, chemoradiation pembrolizumab, followed by maintenance pembrolizumab. We're very excited for your enrollment. It will be open throughout the NRG network, and it will enroll 336 patients. I think one of the most common questions is who's eligible. And as the staging continues to evolve with GYN cancers, we're really looking for patients that fit the FDA label for approval for pembrolizumab. So I just want to reiterate, it's patients who have T3 and T4 lesions, tumors. They can be node positive or node negative. And that node positivity can be N1 in the pelvis node positive or N2 in the periortic region. And then I think that's the main thing, the key eligibility. If there's any questions, you can always contact myself or the cervical cancer leadership of the committee. We are thinking this will be a very impactful trial. Again, it's a randomized phase 3 trial looking at a potential increase in disease-free survival for these patients. And so we do think that data that comes from the trial, data that we collect, we also are collecting biospecimens on the trial, will inform us for cervical cancer in the future, and also how we treat patients as a standard of care for locally advanced cervical cancer. So we're looking at important questions. Primary outcome is looking at survival outcome. Secondary outcomes include looking at safety, tolerability. We're also looking at how patients, continue and whether they continue on maintenance pembrolizumab. We look at key biomarker endpoints. So I think we're going to collect a lot of data on this study. I think one of the main things is because we're looking at this study versus standard of care, we want to make sure that the patients those who enroll are able to stay on this study. We also have questions for the study coordinators and the study treatment team about key eligibility criteria. And we'll be following patients throughout their treatment and beyond. So patients will need to have a regular scheduled follow-up with their providers.